Thank you, Jenny. Hello, everyone. My name is Kathy Gombas, and I'm a Senior Advisor in the Office of Food Safety here at the Center for Food Safety and Applied Nutrition. And I'm so glad you're all here today to hear more about our FSMA Technical Assistance Network. I'm sure all of you right now are thinking, I have so many questions about the preventive controls regulation, and I might not be able to answer them. So what we have done here at FDA is we've actually set up a team of subject matter experts to help answer industry's questions. So what I'm going to do is talk a little bit about the background of launching this Technical Assistance Network, and then I'm actually going to go through a demo to show you how to submit a question. So first, I want to talk about the launch. We actually launched our Technical Assistance Network here at CFSAN, CVM, ORA, and our Office of International Programs on September 10th. This was the day that the preventive controls regulation for human food and animal food went on display at the Federal Register. The reason for the network is to provide technical assistance not only to industry, but our other internal and external stakeholders, such as our regulators, consumers, and others, including academia. The intent of this Technical Assistance Network is to actually provide questions or answers to questions that are related to not only the FSMA rules, but about the programs and our implementation efforts. So as part of doing this, we have partnered with the Food Safety Preventive Controls Alliance and other alliances such as the Produce Safety Alliance to help bond together and answer questions. So let me show you a diagram that will further explain this. If you look at the right-hand side of the diagram, this is the FDA FSMA Technical Assistance Network. As I mentioned before, we have 4 partners within FDA: the Center for Veterinary Medicine, the Center for Food Safety and Applied Nutrition, the Office of Regulatory Affairs, and the Office of International Programs. These experts are working together to answer queries from our stakeholders. You'll see in the center the diagram that says KMS. This is what we're calling our knowledge management system. This is the IT system that houses the knowledge for our experts to answer the questions. And ultimately, FDA will provide this knowledge management system and database for external use. Now I want to shift over to the left-hand side. This is the Preventive Controls Alliance Technical Assistance Network that will answer scientific and technical questions. The FDA side is answering the rule interpretation. We do not want the Alliance's Technical Assistance Network to focus on those rule interpretation, rather on the technical and scientific. So for example, if I'm a small processor, I may have a question about how do I validate my peanut roaster. That would be appropriate for the Preventive Controls Alliance. So who makes up this alliance of network experts? It's actually extension specialists, land-grant universities, and our international partners. I'd like to point out that for the FDA Technical Assistance Network, we actually have an at-a-glance document that walks you through how to submit a question. This is posted on FDA's website on the FSMA page. You can submit inquiries via a web form or by mail in case the internet is down. To submit a question about FSMA, you would visit the website and actually scroll down to the bottom after you've read all of the information about FSMA implementation, and then you would come to a screenshot that looks like this. If you're ready to submit your question, you would actually hit the submit button, but I do want to note that in the center of the screen you can see note for Food Safety Preventive Control Alliance questions, please direct them to the FSPCA. FSPCA will also have a web form to receive their queries. So after you've hit the submit button, you'll come to this particular screen. There are several required fields. The first one is I'm a member of this category. I'll talk about that in a moment. The next one is email, contact information, as well as country. The country is important for our FDA experts because we may notice trends in a particular region in the world where there may be difficulty in understanding the preventive controls regulations. So that will be important for us. We also have zip code for the contact information. Now here it's important, is your inquiry specific to the Food Safety Modernization Act? If you press no, then the web form will take you down our general section of SMEs talking about nutritional labeling, that type of thing. But if you say yes, then we'll actually go to the next screen that will ask about which rule do you have a question. The inquiry, this is where you would actually type your question. We've had to increase the character size because we really want people to provide the details behind their question. That makes it easier for our subject matter experts. Now you'll note at the bottom of the screen, and you're going to see it over and over again, that we will respond to the web queries as soon as possible. However, I want to point out that it will depend on the volume of queries that we receive as well as the complexity of how soon that we can get back to the inquirer. Here's the member category that I mentioned. You can see here we're trying to track and trend by the audience. We have academia, consumer, media, medical, industry, and I will say now that that's the majority of where our questions are coming from on the PC rules at this time. We have other government officials, domestic, that would be, for example, USDA. Other government officials, international. These would be the foreign competent bodies. Regulators, we've outlined here FDA compliance staff, as well as FDA investigators and state inspectors. And again, this will be helpful for us to understand where the questions are coming from so that we can address them long-term through training and guidance documents. So I want to point out here, I mentioned the FSMA topic. If you did say that your question is related to FSMA, then it's going to ask you if your question is specific to a particular rule. You can see that we have preventive controls for animal food as well as human food, and we have recently added produce safety, foreign supplier verification program, as well as accredited third-party certification. The latter three rules went on display November 13th. So once you submit a question, you will receive a case number designated here in the red circle. You want to keep track of this particular case number in the event that you need to use it if you want to elaborate on the question that you've asked, or if we have not provided a response, then you can actually contact us and ask us about the status of your question. Once we do provide an answer, this is what it would look like when you receive the response. In this case, what does FSMA stand for? And the response is the Food Safety Modernization Act. I want to point out the language below, thank you for contacting. It says this communication is intended for the exclusive use of the inquirer and does not constitute an advisory opinion. Please check FDA's webpage regularly for guidance reflecting our current thinking. Now, why is this important? It's important because at the time that we provide you a response from our SMEs, it's based on that time of our current thinking. But as you are all aware, we're going to be generating various guidance documents to help the regulated industry. And once those issue, we may have revised or amended our current thinking. So I want to point out that through our FDA FSMA Technical Assistance Network, we will be trending and tracking the questions using that knowledge management system. Repeat questions will be addressed either through frequently asked questions, which we will post on the FDA website, or they'll be addressed in guidance documents, which will be posted on our FSMA webpage. I hope that this demo has been very useful for you today, and if it hasn't, then post a query through our FSMA Technical Assistance Network. Thank you.